Hey everyone! Today we are going to briefly discuss the treatment of an infection very hard to get rid of, herpes. Before we begin, I must warn you that this video is for educational purposes only. Please do not take any medication without the examination and prescription of a practicing doctor. To treat oral labial herpes simplex virus infections, it is best to use oral acyclovir in tablets of 200 milligrams 5 times a day for 5 to 10 days depending on the severity. For the treatment of genital herpes infections, we use the same medication, oral acyclovir, in tablets of 200 milligrams 5 times a day for 5 to 10 days. IV acyclovir is used for the treatment of very severe infections that cannot be treated by oral medication. To treat recurrent infections that have been latent in the ganglia for a while, it is best to take the medication in the prodromal stage. That means as soon as the patient experiences a tingling sensation. A single dose of famiciclovir of 1500 milligrams is effective in stopping the infection from reappearing. For recurring oral herpetic lesions, topical peniclovir or acyclovir is commonly used 6 times a day. To suppress this condition, we can use oral acyclovir 400 mg tablets twice a day for 5 to 10 days, again depending on the severity. In cases of herpetic eye infections, topical peniclovir or acyclovir are used, usually in the form of eye drops. This may be accompanied by debridement of the eye. It is important to remember that steroids are contraindicated in herpetic eye infections and will only make it worse. So, a correct diagnosis is very important before using any medication. In pregnant women suffering from genital herpes, it is extremely important to treat the mother before the birth of the child to prevent the transmission of this disease, which could be fatal for the infant. Acyclovir has been found to be perfectly safe during pregnancy and has no established side effects. In case of neonatal infection, we use IV acyclovir 60 milligrams per kg for at least 21 days. In cases of erythema multiforme associated HSV infections, oral acyclovir 400 milligrams can be used thrice a day, or valacyclovir 500 milligrams can be used twice a day. To treat hepatic whitlow, we use oral acyclovir in tablets of 200 milligrams 5 times a day for 7 to 10 days. Do check out our other videos on herpes for more information. Remember, no medication should be used without a proper diagnosis and prescription by your doctor. Don't forget to like this video and subscribe to our channel.